Thank you everybody for your presentations. It's been a long morning and afternoon. We're going to have, are we going to have a presentation first, James, and then the students?
Sure, I was going to say a few words, if you'll tolerate that. Make some presentation.
Yeah. So you will be rewarded for your hard work soon with certificates. I think you all did a very good job, and considering it's a new part of this programme to have the improvement project, I've seen that you have all put in a lot of effort today, and you've actually been writing your feedback comments, and you haven't had a big break either, so I know you've been putting in a lot of energy, which is appreciated. So I'd like to introduce James and Ian Miller. They're both going to do a double presentation today. I'm not sure how long you've been here, Ian. Are you new or?
I am fairly new, 3 months, yeah.
3 months, okay.
So what I was going to suggest, and we haven't practiced this before, Ian came thinking he'd observed this, was I'm going to let Ian introduce himself first and say he's the latest addition to our team, to particularly my executive leadership team. I'm delighted that he's here today to see this programme in action. It was one of my first encounters. I think this is at least the 4th set of presentations I've had the privilege to be at in the programme that Harpal has been doing with the organisation. And I remember being very inspired by the first time I came, and very proud of the fact that the organisation, through Leslie's sponsorship, had created such a programme for our colleagues to participate in. I'm going to let Ian say a little word of introduction, and then also any comments he might have, given the theme we're talking about today.
Yeah, thank you very much indeed. It's been a privilege to come and actually see the presentations. I didn't really know what to expect. I joined 3 months ago, and so just over 3 months ago, I was in your kind of position doing a presentation as part of the wonderful recruitment approach that James developed. So I'm really, really impressed with how you stood in front of a group of people, including the chief executive, and just looked so assured and in command of your subject. Absolutely brilliant. I joined 3 months ago. I now have responsibilities for what had been 2 separate directorates. So one that was looking at finance, performance and estates, and another that was looking at HR and IT, and communications and strategy and business development. So you'll see why I've been hanging on words that, I mean, in terms of what you're talking about, in terms of that single point of information, absolutely, bingo. I want to talk to Bill and make sure that you're tapped in with some of the things that are happening about the mobile platforms, that you put staff so much at the centre. I mean, it is key. I mean, we are a people business, and 3,000 people that we've got providing that service, the retention, the induction, those sorts of things, it's absolutely crucial. But I'm so pleased even in hearing some of the things that, Gabrielle, you're talking about in terms of perhaps more sort of straight line, front line business oriented. Actually, you're still talking about communications. You're still talking about things that I hope I can be part of the solution. And that's really what's impressed me so much, is that there isn't some organisations talk about a front line and a back office. And actually what I'm hearing all of you saying is the communications, the IT, even if it's just IT in terms of getting communications with CLCH, and Linda was talking about, there's so much of an integration between front and back office that there really isn't that distinction anymore. And I welcome that, because I'm here to try and make a difference for patients and patient outcomes. So, as I say, a real privilege to hear the kind of things that you're working on. Thank you very much. I mean, how you dealt with the Q&A at the end as well. I mean, the passion is coming through. So, what you know about your subject is fantastic. I thank you, and you've definitely earned a certificate and more. So, no, thank you. Before I hand over to James, was there anything that I might be able to answer questions that you've got? Because you were so good in having that Q&A slot for us.
Can you mentor all of us?
No, seriously, if you want to have any kind of conversations by emails, 1 or 2 people have come up and said, I'd like to, have a conversation with you outside of this. I'd welcome it. So please do. Ian.Millar with an A, manual address, and let me know, and we can get into it.
Thank you.
Thank you.
Thank you, Ian. Well, like Ian, as I said, I never fail to come and be inspired when I'm here, and I'm always disappointed that I haven't been able to be with you the whole day and hear all the presentations, because we've heard the last 5, and I know there were 10 similarly excellent presentations earlier in the day for that. So that's my loss, your gain, that you've got so many colleagues who there we go. So we can use them in a variety of ways. Again, I think in a way people who select onto this course are hugely motivated, both around their own self-advancement, quite rightly, their career development, but also around how services will develop and improve, because I think the two go hand in hand. And it's only on the back of our results that we deliver for our organisations that we can kind of get the recognition and the advancement that we're seeking. And I think the presentations bring that out. The fact that we can all, as aspiring leaders, and that includes myself, gain some skills that we can add to our innate the characteristics, the strengths that we're born with, as it were, that our families and others have formed us with, is really important. One of the key traits of good leaders that I have held on to in my career is that first and foremost you have to be authentic, you have to be true to yourself, but at the end of the day we all follow people. We don't follow sort of automatons, and if somehow we can't understand the authenticity of the individual we're working with, if we can't get to know them a bit and trust them and feel a bit inspired in what they have to offer, it's quite hard to follow them in those circumstances. So skills on their own, without that authenticity, are not enough. But authenticity, just being a really wonderful, inspiring, charismatic individual without much skill, is also not enough. There are what I call the sort of firework candidates. They're people who make a great flash, and it's really impressive, but it dwindles very quickly. You know, I mean, it was nice while it lasted, but it is a flash. And one of the great challenges for us as we evolve into better leaders is to think about how we can sustain our development and our leadership potential. What struck me in the collection of 5 presentations we heard this afternoon was that there were 5 key P's, if you'll not P's in a pod, but P's that you reflect that I think are really important to leadership and management. I come back to the point I've just made. First of all, it's about people, patients, and colleagues in essence, and if we don't think about the end outcome, and so many of your presentations were about what outcome am I trying to achieve here? What's the end result to the end user? At the end of the day, we're here about better health for people, as we say, a better start for children and greater independence for adults. In my improvement project, in my daily work, in the working processes that I'm responsible for and managing, what outcomes are going to change for those end users? Vitally important to keep the end user in place. So that's the first P, the patients or the people that we serve, if you want. But I wouldn't want us to forget, and maybe your project brought it out, that people as colleagues, you know, how I feel today and tomorrow about coming into work and whether I'm proud of what we do is so much how I feel about the team I'm part of and how they make me feel about myself. If there's trouble at mill, if there's a poor dynamic in a team, it's going to drag me down, it's going to drag the whole service down. So working with those people in that way. Another key P for me is the processes. You all spoke about how we could address processes, and the creativity was how we could change some of the habitual processes we've got in the organisation. So some of your innovations and improvement places were about, well, we might get information this way, what if we had it that way? We might get compliance in this way, what if we had it that way? It's about changing a key process, and particularly habitual processes, I think, are ones that can drag us back again, and being prepared to challenge those when quite a lot of our colleagues will feel, hang on a moment, I'm not quite comfortable doing it like this, thank you very much. And you get that first initial response of a resistance to change. So processes are really important. Then you talked a lot about partners in your presentations, one way or another, whether it's internal partners in the organisation, whether you're trying to mobilise some of the resources that Ian's got at his disposal, our IT colleagues, our HR colleagues, our research colleagues, etc. But how can I mobilise those internal partners to help build up, develop, encourage my service in a way that is developed? But you also spoke, and I guess the diabetes project was particularly about the partnership that we have there with external partners. In community healthcare, there's virtually no patient pathway that we deliver exclusively on our own. Because we deal with patients in their own homes and in the community, they are being supported by a number of different agencies. And as a result, whether we like it or not, we are working in partnership. From their perspective, they don't know that we sit in these different organisations with names like Central London Community Healthcare or Imperial College Trust or what have you. They just think it's the NHS, and they can't understand, actually, that we're not under some sort of unified management. But making those partnerships work really strongly is vital. Your point, Gabrielle, was about the community as a partner. And the number of examples you used of either using faith communities or community organisations, again, we serve this highly diverse population with diverse needs and diverse cultures, and we're not going to understand how that all works and how that can be encouraged. So, there's a key in our name as a trust. We are a community healthcare trust, and we don't exploit that opportunity. And when you do work with community groups, as I have done in the past, they're very willing, they're very open, they're waiting there to be asked, actually, and there is tremendous reach at the end of the day. So working with people, with professionals, your colleagues, with the processes that you've got, with partners. But then the last one I want to do is the program you've been engaged with is about profile. The NHS has a profile. It was sort of magnificently displayed, I guess, in the Olympics. It's the big moment it went global as a sort of brand in that amazing display. Nationally, it's one of the most trusted, it is the most trusted organisation in the public sector by a long chalk. So we do have a large profile. It's having a few knocks at the moment as we face up to the changes we've got to make and face up to some of the limitations. And in one sense, I welcome that. If you have too much of a halo around your head, the only way you're going to do is fall. You're going to fall on your face. But the issue about raising the profile of what we do and how we market or promote is another piece. Not just myself in my career into my organisation, which is something that Harpal and others have been working with you on, but also how we gain the skills that you've been manifesting today to really think about how I can promote with pride what I do and how I can wow people with that, and who are the audiences that I'm talking to. And I know today we asked a few questions, we weren't evaluating your presentations, but I know you are doing feedback to one another as peer groups to help you improve thinking about, well, that was really good, but this bit worked, that bit didn't work. That sense of evaluating what you're doing with promotion. So you may want to think, as you develop yourselves around leadership going forward, about those 5 particular P's that I've been speaking about. It's helped me sort of think about, am I touching all the bases when I'm trying to exercise my leadership skills? But I want to end on a note before we get to the formalities, and you do get that well-deserved reward for your labour, of again thanking you very much for putting yourselves forward into the programme, for taking responsibility for your own lives and destinies, not everybody does that, for using the opportunity that's presented to you, for committing time alongside busy day jobs, and they just get busier all the time as it gets tougher out there, to do the work, and I hope that you, particularly individually, will each reap the rewards of what you've invested in this. I know we will, as an organisation, without any doubt, reap the rewards of that. And I want to wish you the very best in your endeavours, whether you're remaining with the Trust, or sadly as things move on and change, as they will continue to change, wherever you land up working for the public, for patients, for better outcomes. I want to wish you all very well and congratulate you on that.